Question 1. Cost-benefit analysis shows that addressing a common behavioral disorder like separation anxiety in a canine patient can significantly improve the animal's quality of life and reduce property damage, but the owner expresses significant financial concerns regarding the cost of professional training and medication. Which approach best balances the animal's welfare with the owner's limitations? Option A. Develop a tiered intervention plan that starts with owner-taught, low-cost behavioral modification techniques and environmental enrichment, with options for medication and professional training to be introduced if the initial steps are insufficient and the owner's financial situation improves. Option B. Recommend immediate enrollment in an intensive, high-cost residential training program, as this offers the quickest and most comprehensive solution for separation anxiety. Option C. Suggests that the owner simply increase exercise and provide more toys, as these are generally effective for most behavioral issues and are low cost. Option D. Advise the owner that without immediate access to expensive pharmacological interventions and specialized behaviorist consultations, the prognosis for managing separation anxiety is poor, and euthanasia should be considered. The correct answer is A. Develop a tiered intervention plan that starts with owner-taught, low-cost behavioral modification techniques and environmental enrichment, with options for medication and professional training to be introduced if the initial steps are insufficient and the owner's financial situation improves. Explanation: this scenario is professionally challenging because it requires the veterinary technician to balance the immediate needs of the animal with the owner's financial constraints and understanding of behavioral modification. The technician must assess the severity of the behavioral disorder, its potential impact on the animal's welfare and safety, and the feasibility of various interventions. This requires not only knowledge of animal behavior, but also strong communication skills and ethical judgment. The correct approach represents best professional practice because it prioritizes the animal's welfare while respecting the owner's autonomy and resources. It involves a thorough assessment, collaborative development of a realistic plan, and ongoing support. This aligns with the veterinary technician's ethical obligation to provide competent care and advocate for the animal, while also acknowledging the client's role in the animal's life and the practical limitations they may face. This approach fosters a trusting relationship and increases the likelihood of successful long-term management of the behavioral disorder. An incorrect approach that focuses solely on expensive, high-tech solutions without considering the owner's financial situation or the animal's specific needs fails to uphold the principle of providing appropriate and accessible care. It could lead to the owner being unable to afford or implement the recommended plan, resulting in the animal not receiving necessary treatment and potentially experiencing a worsening of its condition or even euthanasia. This neglects the technician's duty to consider the client's circumstances and provide practical, achievable solutions. Another incorrect approach that dismisses the owner's concerns or financial limitations as unimportant disregards the client-centered aspect of veterinary care. The owner is a crucial partner in the animal's care, and their perspective and capacity must be respected. Ignoring these factors can lead to a breakdown in communication, non-compliance with treatment, and ultimately, a negative outcome for the animal. This violates the ethical imperative to work collaboratively with the client. A third incorrect approach that suggests immediate euthanasia without exploring all viable behavioral modification options, even for a manageable disorder, is premature and unethical. Veterinary technicians are expected to exhaust all reasonable avenues for treatment and management before considering euthanasia, which should be a last resort for conditions that are untreatable and causing significant suffering. This approach fails to uphold the commitment to animal welfare and the principle of providing a chance for rehabilitation. The professional decision-making process for similar situations should involve a systematic approach. 1. Comprehensive assessment. Gather detailed history from the owner, observe the animal's behavior, and conduct a physical examination to rule out underlying medical causes. 2. Diagnosis and prognosis. Formulate a diagnosis of the behavioral disorder and discuss the prognosis with the owner, including potential outcomes and the commitment required. 3. Collaborative plan development. Work with the owner to create a realistic and individualized treatment plan that considers the animal's needs, the owner's lifestyle, financial capabilities, and commitment level. This plan should include clear, actionable steps for behavioral modification, environmental management, and potentially medication. 4. Education and support. Provide the owner with clear instructions, resources, and ongoing support throughout the treatment process. Regular follow-ups are essential to monitor progress, address challenges, and adjust the plan as needed. 5. Ethical considerations. Continuously evaluate the animal's welfare and the owner's capacity to provide care, ensuring that all decisions are made in the best interest of the animal, while respecting the human-animal bond and the owner's role. Question 2. The control framework reveals that a veterinary technician is preparing to administer a newly prescribed analgesic to a canine patient. The drug is known to have a relatively long half-life. Which of the following considerations is most critical for ensuring the safe and effective administration of this medication, directly reflecting basic pharmacological principles? Option A. Focusing solely on how quickly the drug will reach its peak plasma concentration after administration. Option B. Prioritizing the route of administration as the primary determinant of the drug's overall efficacy and safety. Option C. Assuming that all analgesics within the same drug class will have identical pharmacokinetic profiles in this patient. Option D. Understanding how the drug's half-life influences the dosing interval to maintain therapeutic levels and minimize toxicity. Correct answer is D. Understanding how the drug's half-life influences the dosing interval to maintain therapeutic levels and minimize toxicity. Explanation. Scenario analysis. This scenario presents a common challenge in veterinary practice, where a veterinary technician must interpret and apply pharmacological principles to ensure patient safety and efficacy of treatment. The challenge lies in understanding how a drug's absorption, distribution, metabolism, and excretion pharmacokinetics influence its therapeutic effect and potential for adverse reactions, pharmacodynamics, in a specific patient. Accurate application of these principles is critical for appropriate drug selection, dosing, and monitoring, directly impacting patient outcomes and adhering to professional standards of care. Correct approach analysis. The correct approach demonstrates a thorough understanding of pharmacokinetics and pharmacodynamics by considering how the drug's properties interact with the patient's physiological state. Specifically, recognizing that a drug's half-life, a pharmacokinetic parameter, dictates the frequency of administration to maintain therapeutic concentrations and avoid toxicity. A pharmacodynamic consideration is fundamental. This aligns with the veterinary technician's role in administering medications safely and effectively, as outlined by the Veterinary Technician National Examination (VTNE) content outline, which emphasizes understanding drug actions and effects. Best professional practice involves applying this knowledge to anticipate and manage potential patient responses, ensuring compliance with veterinary medical directives and ethical responsibilities to the animal. Incorrect approach is analysis. One incorrect approach fails to consider the drug's elimination rate from the body, focusing solely on the onset of action without understanding how long the drug remains effective or potentially toxic overlooks crucial pharmacokinetic principles. This can lead to underdosing, rendering the treatment ineffective, or overdosing, increasing the risk of adverse drug reactions, which violates the duty of care and professional responsibility to prevent harm. Another incorrect approach prioritizes the route of administration over the drug's inherent pharmacokinetic and pharmacodynamic properties. A route of administration influences absorption rate. It does not solely determine the overall pharmacokinetic profile or the drug's effect on the body. Neglecting to consider how the drug is metabolized and excreted, or its mechanism of action, can lead to inappropriate dosing intervals or an underestimation of potential side effects, thereby compromising patient safety and deviating from evidence-based practice. A third incorrect approach incorrectly assumes that all drugs of the same class will behave identically in all patients. This ignores the significant interpatient variability in drug metabolism and excretion due to factors like age, disease state, and concurrent medications. Failing to account for these pharmacokinetic differences can lead to unpredictable therapeutic outcomes and increased risk of adverse events, which is a failure to apply critical thinking and a deviation from responsible medication management. Professional reasoning. When faced with administering a new medication or managing a patient on medication, a veterinary technician should first review the drug's monograph or formulary to understand its pharmacokinetic properties, absorption, distribution, metabolism, excretion, and pharmacodynamic properties, mechanism of action, therapeutic effects, adverse effects. This information should then be correlated with the specific patient's signalment, history, and current physiological status. The veterinarian's prescribed dosage and frequency should be critically evaluated in light of this understanding to ensure it is appropriate for the individual patient and the condition being treated. Any concerns or potential issues should be immediately communicated to the veterinarian. Question 3. Strategic planning requires a veterinary technician to anticipate and respond to potential physiological complications in a canine patient recovering from an ovariohysterectomy. Given the patient's history of general anesthesia and surgical stress, which of the following assessment approaches best ensures the maintenance of homeostasis and early detection of adverse events? Option A. Continuously monitoring a broad spectrum of vital signs including heart rate, respiratory rate, mucous membrane color, capillary refill time, and observing the patient's overall demeanor for subtle changes. Option B. Relying on the assumption that all postoperative physiological variations are expected and will resolve without intervention. Option C. Focusing exclusively on the patient's body temperature, assuming other parameters will remain within normal limits if the temperature is stable. Option D. Administering a prescribed analgesic based on a single observed elevated heart rate without consulting the veterinarian. The correct answer is A. Continuously monitoring a broad spectrum of vital signs including heart rate, respiratory rate, mucous membrane color, capillary refill time, and observing the patient's overall demeanor for subtle changes. Explanation. Scenario analysis. This scenario presents a common challenge in veterinary practice where a technician must interpret subtle physiological changes in a patient recovering from surgery. The challenge lies in distinguishing normal postoperative fluctuations from early signs of a serious complication, requiring a deep understanding of homeostasis and the potential impact of anesthesia and surgical stress on physiological parameters. Accurate assessment is critical for timely intervention, directly impacting patient outcome and client satisfaction. Correct approach analysis. The correct approach demonstrates best professional practice by prioritizing a comprehensive assessment of multiple physiological parameters in the context of the patient's recent surgical procedure and anesthetic history. This aligns with the VTNE emphasis on applying scientific knowledge to clinical situations. By considering heart rate, respiratory rate, mucous membrane color, capillary refill time, and patient demeanor, the technician is evaluating the patient's overall cardiovascular and respiratory status, as well as tissue perfusion and neurological response, all key indicators of homeostatic balance. This holistic approach allows for the detection of subtle deviations that might otherwise be missed, enabling prompt communication with the veterinarian for further diagnostic and therapeutic decisions. This aligns with the ethical responsibility to provide competent care and advocate for the patient's well-being. Incorrect approaches analysis. One incorrect approach focuses solely on a single parameter, such as only monitoring temperature. While temperature is important for homeostasis, it is not a comprehensive indicator of overall stability, especially in the immediate postoperative period. Relying on a single parameter can lead to a false sense of security or an overreaction to a minor, transient change, failing to identify more critical issues affecting other organ systems. This approach lacks the depth of analysis expected for competent patient care and could violate the ethical duty to provide thorough assessment. Another incorrect approach involves assuming all postoperative changes are normal without further investigation. This dismisses the potential for complications like hypovolemia, pain, or respiratory depression, which can manifest as subtle physiological shifts. Such an assumption neglects the technician's role in vigilant monitoring and early detection, potentially delaying critical interventions and contravening the professional obligation to ensure patient safety and optimal recovery. A third incorrect approach might be to administer a medication without veterinary direction based on a single observed abnormality. This bypasses the veterinarian's role in diagnosis and treatment planning, potentially leading to adverse drug interactions or masking underlying issues. It represents a failure to adhere to the scope of practice for a veterinary technician and a breach of professional responsibility to work collaboratively with the veterinarian. Professional reasoning. Professionals should approach postoperative monitoring with a systematic and comprehensive mindset. This involves 1. Understanding the patient's baseline and the expected physiological effects of the specific surgery and anesthetic protocol. 2. Continuously assessing a range of vital signs and physical parameters, looking for trends and deviations from the expected. 3. Correlating findings with the patient's overall condition and demeanor. 4. Communicating any concerns or significant changes promptly and clearly to the veterinarian. This decision-making process ensures that patient care is proactive, evidence-based, and ethically sound, prioritizing patient well-being and safety. Question 4. The evaluation methodology shows a veterinary technician observing a biopsy slide under a microscope. The technician identifies the predominant tissue type as epithelial tissue exhibiting abnormal cellular morphology and a significant increase in mitotic figures. The technician also notes the presence of a highly vascularized connective tissue stroma. The client, who is present and asking questions, wants to know what this means for their pet. Which of the following represents the most appropriate and ethically sound approach for the veterinary technician in this scenario? Option A. The technician provides a detailed explanation of the different types of epithelial and connective tissues and their normal functions, without addressing the observed abnormalities or the client's specific concerns. Option B. The technician explains that the abnormal epithelial cells and increased mitotic activity, along with the vascularized stroma, are indicative of a rapidly growing tumor and advises the client on potential treatment options. Option C. The technician tells the client that the slide appears normal and there is nothing to be concerned about, as they are not qualified to interpret such samples. Option D. The technician states that they have observed epithelial and connective tissues with some unusual features, and will relay these findings to the veterinarian for interpretation and discussion with the client. The correct answer is B. The technician explains that the abnormal epithelial cells and increased mitotic activity, along with the vascularized stroma, are indicative of a rapidly growing tumor and advises the client on potential treatment options. Explanation. Scenario analysis. This scenario presents a professional challenge because a veterinary technician is tasked with interpreting and communicating complex histological findings to a client without direct veterinary supervision. The challenge lies in accurately identifying tissue types and their functional implications, understanding the potential impact on the animal's health, and conveying this information appropriately and ethically to a layperson. Misinterpretation or miscommunication could lead to client anxiety, incorrect treatment decisions, or a breach of professional boundaries. Correct approach analysis. The correct approach involves recognizing the limitations of the veterinary technician's role in direct client communication regarding diagnosis and prognosis. Best professional practice dictates that the technician should accurately identify the tissue types and their basic functions as observed under the microscope, but defer any interpretation of disease, diagnosis, or treatment recommendations to the veterinarian. This aligns with the VTNE emphasis on understanding the foundational knowledge of animal physiology and histology, while also respecting the scope of practice and the veterinarian's ultimate responsibility for patient care and client communication. Ethical guidelines and regulatory frameworks for veterinary technicians typically prohibit them from diagnosing or prescribing, and this scenario tests the technician's ability to operate within those boundaries. Incorrect approaches analysis. One incorrect approach involves the technician attempting to diagnose the condition based solely on the observed tissue types and their abnormalities. This is a direct violation of the veterinary technician's scope of practice, which prohibits independent diagnosis. Such an action could lead to misdiagnosis, delayed or inappropriate treatment, and potential harm to the animal, constituting a significant ethical and regulatory failure. Another incorrect approach is to provide a detailed prognosis or treatment plan to the client. This also exceeds the technician's authorized duties and encroaches upon the veterinarian's responsibilities. It can create false expectations, undermine the veterinarian's authority, and potentially lead to client confusion or non-compliance with the veterinarian's actual recommendations. This represents a failure to adhere to professional ethical standards and regulatory guidelines regarding client communication and the division of responsibilities. A third incorrect approach is to dismiss the findings entirely or provide vague, unhelpful information to the client. While avoiding overstepping boundaries is crucial, a complete lack of informative communication about the observed tissue types and their general functions, without offering to relay the information to the veterinarian, could be seen as a failure to uphold professional responsibility to assist in patient care. This approach, while not as egregious as diagnosing, still falls short of best practice by not facilitating the necessary communication pathway to the veterinarian. Professional reasoning. Professionals should approach such situations by first accurately identifying the observed tissues and their normal functions based on their training and knowledge. They should then recognize the point at which their role transitions from observation and basic identification to interpretation and communication of diagnostic information. The decision-making process involves prioritizing patient welfare, adhering strictly to the established scope of practice, and ensuring clear, ethical communication channels with the supervising veterinarian. When faced with client inquiries about diagnostic findings, the technician's primary responsibility is to relay the information accurately to the veterinarian and to inform the client that the veterinarian will discuss the findings and implications. Question 5. The control framework reveals that a veterinary technician is reviewing thoracic radiographs of a feline patient presented for dyspnea. The veterinarian notes a rounded opacity in the caudal thorax, suggesting a diaphragmatic hernia. The technician, recalling their studies in comparative anatomy, recognizes that the normal appearance of a feline diaphragm can differ significantly from that of a canine diaphragm, potentially leading to misinterpretation of radiographic findings. Which of the following actions best demonstrates the technician's professional responsibility in this situation? Option A. Politely inform the veterinarian that the rounded opacity is likely a normal anatomical variation in feline diaphragmatic structure, referencing specific comparative anatomical differences that could cause this appearance. Option B. Advise the veterinarian that the opacity is definitely not a diaphragmatic hernia, because feline diaphragms are always perfectly flat on radiographs. Option C. Suggest that the veterinarian order an ultrasound of the abdomen to rule out other causes of dyspnea without mentioning the diaphragmatic anatomy. Option D. Immediately proceed with preparing the patient for surgical intervention, assuming the veterinarian's diagnosis is correct. The correct answer is A. Politely inform the veterinarian that the rounded opacity is likely a normal anatomical variation in feline diaphragmatic structure, referencing specific comparative anatomical differences that could cause this appearance. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the veterinary technician to apply knowledge of comparative anatomy to a clinical situation involving a potential diagnostic error. Misinterpreting anatomical differences between species can lead to incorrect treatment plans, patient harm, and a breach of the standard of care expected in veterinary medicine. The technician must critically evaluate the veterinarian's initial assessment based on their understanding of species-specific anatomy. Correct approach analysis. The correct approach involves recognizing the significant anatomical differences between a feline and a canine diaphragm, and understanding how these differences might affect the interpretation of diagnostic imaging. A feline diaphragm has a more pronounced central tendon and a less muscular peripheral rim compared to a canine diaphragm. This can lead to a more rounded or dome-shaped appearance on radiographs, which, if not properly contextualized by species-specific anatomy, could be misidentified as pathology. By questioning the initial interpretation and suggesting a reevaluation based on comparative anatomy, the technician upholds their ethical and professional responsibility to advocate for patient well-being and ensure accurate diagnostics. This aligns with the VTNE emphasis on applying scientific knowledge to clinical practice and maintaining a high standard of patient care. Incorrect approaches analysis. One incorrect approach involves blindly accepting the veterinarian's interpretation without critical evaluation. This demonstrates a failure to apply comparative anatomical knowledge and a lack of professional diligence. Ethically, veterinary technicians have a duty to their patients and to the veterinary team to contribute to accurate diagnosis and treatment. Failing to question a potentially erroneous interpretation, especially when it stems from a fundamental understanding of species anatomy, is a dereliction of this duty. Another incorrect approach is to dismiss the veterinarian's interpretation without providing a reasoned, anatomically based explanation. Questioning is important, doing so without a clear, evidence-based rationale. In this case, comparative anatomy can be perceived as insubordination rather than professional contribution. This approach fails to leverage the technician's specialized knowledge effectively and could lead to interpersonal friction without improving patient care. A third incorrect approach is to focus solely on the radiographic appearance without considering the species-specific anatomical context. While radiographic interpretation is crucial, it must always be integrated with knowledge of normal anatomy for the species in question. Ignoring the comparative anatomical differences between a cat and a dog when interpreting a diaphragm's appearance is a fundamental error that can lead to misdiagnosis. This demonstrates a superficial understanding of diagnostic imaging principles and a failure to apply comprehensive anatomical knowledge. Professional reasoning. Veterinary technicians should employ a systematic approach when faced with potential diagnostic discrepancies. This involves 1. Actively listening to and understanding the veterinarian's initial assessment. 2. Accessing and applying relevant knowledge, including comparative anatomy, physiology, and pathology. 3. Critically evaluating the information in light of this knowledge. 4. Formulating questions or providing observations based on sound reasoning and evidence. 5. Communicating these observations clearly and professionally to the veterinarian, focusing on patient welfare and diagnostic accuracy. This process ensures that patient care is prioritized and that the technician actively contributes to the veterinary team's diagnostic and therapeutic efforts. Question 6. The monitoring system demonstrates a consistent decrease in end-tidal CO2, ECO2, over the last 5 minutes, while heart rate has remained stable and blood pressure has slightly increased. The patient is receiving isoflurane at a maintenance level. Which of the following actions best reflects appropriate anesthetic management in this situation? Option A. Increase the isoflurane concentration to deepen the anesthetic plane. Option B. Administer a bolus of intravenous fluids. Option C. Document the findings and continue monitoring without intervention. Option D. Decrease the isoflurane concentration and assess ventilation. The correct answer is A. Increase the isoflurane concentration to deepen the anesthetic plane. Explanation. This scenario is professionally challenging because the veterinary technician must interpret multiple physiological parameters simultaneously, recognize subtle deviations from normal, and understand the potential implications for patient safety under anesthesia. The technician's judgment is critical in determining the appropriate intervention, balancing the need for prompt action with the risk of over-intervention. The correct approach represents best professional practice because it prioritizes patient well-being by directly addressing the most critical physiological indicator of anesthetic depth and oxygenation. This aligns with the veterinary technician's ethical and legal responsibility to provide competent patient care and to act within the scope of practice as defined by Veterinary Practice Acts and professional guidelines, which emphasize continuous patient monitoring and timely intervention to prevent adverse outcomes. An incorrect approach that focuses solely on a less critical parameter, such as heart rate without considering other factors, fails to address the immediate threat to the patient's life. This could be considered a breach of professional duty of care, potentially violating regulations that mandate appropriate monitoring and intervention. Another incorrect approach that involves delaying intervention until a more dramatic change occurs overlooks the principle of proactive patient management and the importance of recognizing trends rather than isolated events. This delay could lead to irreversible patient compromise and constitutes a failure to meet the standard of care expected of a veterinary technician. An approach that relies on assumptions without verifying data, such as assuming a stable anesthetic plane based on one parameter, demonstrates a lack of critical thinking and a failure to adhere to evidence-based monitoring protocols, which are often implicitly or explicitly required by regulatory bodies. Professionals should use a decision-making framework that involves 1. Continuous assessment of all monitored parameters. 2. Correlating findings with the patient's current status and anesthetic protocol. 3. Identifying the most critical deviation. 4. Formulating a differential diagnosis for the deviation. 5. Consulting with the veterinarian if necessary. And 6. Implementing the most appropriate intervention based on established protocols and veterinary direction. Question 7. Assessment of a canine patient reveals a palpable mass in the abdominal region during routine palpation. The veterinary technician has identified the mass's approximate size and location, and notes the patient appears comfortable and shows no immediate signs of distress. Considering the anatomical structures of the canine abdomen, which of the following actions best aligns with the veterinary technician's professional responsibilities and regulatory framework? Option A. Advise the owner that the mass is likely benign and recommend a wait-and-see approach without veterinary consultation. Option B. Immediately inform the veterinarian of the palpable mass, its characteristics, and the patient's current demeanor, recommending further diagnostic investigation. Option C. Attempt to surgically excise the mass to alleviate potential future complications. Option D. Document the finding but take no further action until the veterinarian specifically asks about abdominal palpation findings. The correct answer is B. Immediately inform the veterinarian of the palpable mass, its characteristics, and the patient's current demeanor, recommending further diagnostic investigation. Explanation. This scenario presents a professional challenge because it requires the veterinary technician to apply their knowledge of animal anatomy and physiology in a practical, clinical setting, while adhering to the ethical and legal standards governing veterinary practice. The technician must not only identify the anatomical structures involved, but also understand their physiological function and potential implications for patient care. The challenge lies in accurately assessing the situation and recommending the most appropriate course of action based on established veterinary protocols and the specific needs of the animal, all within the scope of their professional responsibilities. The correct approach represents best professional practice because it prioritizes patient well-being and adheres to the established scope of practice for veterinary technicians. By consulting with the veterinarian, the technician ensures that diagnostic and treatment decisions are made collaboratively and are based on the veterinarian's ultimate authority and expertise. This aligns with regulatory frameworks that define the roles and responsibilities of veterinary technicians, emphasizing their supportive function under veterinary supervision. Ethical guidelines also mandate that veterinary professionals act in the best interest of the animal and maintain professional competence. An incorrect approach that involves independently diagnosing the condition and prescribing treatment would represent a significant regulatory and ethical failure. This directly violates the scope of practice for veterinary technicians, which typically prohibits independent diagnosis and prescription. Such an action could lead to inappropriate treatment, harm to the animal, and legal repercussions for both the technician and the veterinary practice. Another incorrect approach, such as ignoring the observed abnormality due to a lack of immediate understanding, would be an ethical failure, as it neglects the professional duty to report and seek assistance for potential patient distress or illness. This demonstrates a lack of diligence and commitment to patient care. Professional decision-making in such situations should involve a systematic process. First, the veterinary technician should meticulously observe and document the clinical signs. Second, they should access their knowledge of relevant anatomy and physiology to form a differential list of potential issues. Third, and critically, they must communicate their findings and concerns clearly and promptly to the supervising veterinarian. This collaborative approach ensures that the animal receives timely and appropriate veterinary care, while upholding the legal and ethical standards of the profession. Question 8. System analysis indicates that a veterinary technician is performing routine blood chemistry analysis and observes a significant, unexpected deviation in a critical parameter for a patient. The instrument's internal quality control checks have not flagged any errors, but the technician has noted similar minor fluctuations in previous runs from the same instrument. The technician is considering several approaches to address this situation. Which of the following represents the most appropriate and professionally responsible course of action? Option A. Proceed with interpreting the results based on the patient's clinical signs, assuming the instrument is functioning correctly. Option B. Continue with the current testing protocol, assuming the deviation is a transient anomaly and will resolve on its own. Option C. Discard the inconsistent results and simply rerun the test without investigating the cause of the initial discrepancy. Option D. Immediately recalibrate the analyzer and rerun the patient sample to obtain accurate results. The correct answer is D. Immediately recalibrate the analyzer and rerun the patient sample to obtain accurate results. Explanation. Scenario analysis. This scenario presents a common challenge in veterinary laboratory settings, ensuring the accuracy and reliability of diagnostic results when faced with potential equipment malfunction or procedural deviations. The professional challenge lies in identifying the root cause of inconsistent results and implementing corrective actions that uphold patient care standards and regulatory compliance without compromising the integrity of ongoing diagnostics. The veterinary technician must exercise critical judgment to differentiate between minor anomalies and significant issues that could lead to misdiagnosis or inappropriate treatment. Correct approach analysis. Implementing a systematic troubleshooting protocol that begins with verifying instrument calibration and reagent quality is the best professional practice. This approach directly addresses potential sources of error in the laboratory workflow. Regulatory frameworks, such as those implicitly guided by the Principles of Good Laboratory Practice, GLP, and the AVMA Committee on Veterinary Technician Education and Activities, CVT, accreditation standards, emphasize the importance of validated procedures and properly functioning equipment for accurate diagnostic testing. Ethically, providing accurate results is paramount to ensuring appropriate patient care and client trust. This systematic approach minimizes the risk of false positives or negatives, thereby protecting animal welfare. Incorrect approach is analysis, failing to recalibrate the instrument, and instead proceeding with testing using potentially compromised reagents is a significant regulatory and ethical failure. This bypasses fundamental quality control measures, violating the principle of accurate testing mandated by professional standards. It risks generating unreliable data, leading to incorrect diagnoses and potentially harmful treatment decisions, which is a direct breach of the duty of care owed to the animal patient. Assuming the instrument is functioning correctly without verifying calibration, and instead focusing solely on the patient's clinical signs to interpret the results, is also professionally unacceptable. A clinical correlation is vital. It cannot substitute for the integrity of the laboratory data. This approach ignores the potential for laboratory error to skew interpretation, leading to a misdiagnosis if the laboratory results are flawed. It represents a failure to adhere to quality control protocols that are essential for reliable diagnostic services. Discarding the inconsistent results and rerunning the test without investigating the cause of the initial discrepancy is another failure. While retesting is often necessary, doing so without understanding the source of the anomaly means the underlying issue may persist, leading to repeated unreliable results. This approach does not address the root cause of the quality control failure, and therefore does not ensure the long-term reliability of the laboratory's diagnostic capabilities. Professional reasoning. Professionals should approach laboratory discrepancies with a structured problem-solving mindset. First, acknowledge the inconsistency and its potential impact. Second, consult standard operating procedures, SOP, for troubleshooting and quality control. Third, systematically investigate potential sources of error, starting with the most fundamental elements like calibration, reagents, and sample integrity. Fourth, document all findings, actions taken, and resolutions. Finally, communicate any significant issues or deviations to the supervising veterinarian. This process ensures that decisions are evidence-based, compliant with professional standards, and prioritize patient safety and accurate diagnostics. Question 9. Benchmark analysis indicates that a veterinary technician is presented with a complete blood count, CBC, and a serum biochemistry panel for a canine patient exhibiting lethargy and decreased appetite. The CBC shows a mild leukocytosis, and the biochemistry panel reveals a moderately elevated alkaline phosphatase ALP and a slightly decreased albumin. Which approach best reflects the technician's role in interpreting these laboratory diagnostics? Option A. Correlate the laboratory findings with the patient's clinical signs and signalment, and present a summary of potential implications to the veterinarian for further diagnostic and treatment planning. Option B. Immediately inform the owner that the dog has liver disease based on the elevated ALP and low albumin. Option C. Conclude that the leukocytosis is indicative of an infection and recommend specific antibiotic therapy. Option D. Report the laboratory values as is to the veterinarian, without any interpretation or correlation to the patient's clinical presentation. The correct answer is A. Correlate the laboratory findings with the patient's clinical signs and signalment, and present a summary of potential implications to the veterinarian for further diagnostic and treatment planning. Explanation. Scenario analysis. This scenario presents a common challenge in veterinary practice, where a technician must interpret laboratory results in the context of a patient's clinical presentation. The difficulty lies in recognizing that laboratory values are not absolute indicators of disease, but rather pieces of a larger diagnostic puzzle. A technician must understand the limitations of each diagnostic test and how various factors can influence results, necessitating a critical and informed approach to interpretation. Correct approach analysis. The correct approach involves a comprehensive review of all available data, including the patient's history, physical examination findings, and all laboratory results. This holistic evaluation allows for a more accurate and clinically relevant interpretation. It aligns with best professional practice by prioritizing patient well-being and accurate diagnosis, which are fundamental ethical and professional responsibilities for veterinary technicians. This approach is supported by the general principles of veterinary practice, which emphasize the importance of integrating all diagnostic information for optimal patient care. Incorrect approach is analysis. One incorrect approach involves solely focusing on a single abnormal laboratory value without considering the broader clinical picture. This can lead to misdiagnosis or unnecessary further testing, potentially causing patient harm and financial burden to the client. Ethically, this fails to uphold the duty of care to the patient. Another incorrect approach is to dismiss all laboratory results as unreliable without further investigation or consultation. This demonstrates a lack of critical thinking and can delay necessary treatment, directly impacting patient outcomes. Professionally, it undermines the value of diagnostic testing and the technician's role in supporting veterinary medical decisions. A third incorrect approach is to make a definitive diagnosis based solely on laboratory findings without veterinary oversight. This exceeds the scope of practice for a veterinary technician and could lead to inappropriate treatment or management plans, posing a significant risk to the patient and violating professional boundaries. Professional reasoning. When faced with laboratory results, veterinary technicians should employ a systematic decision-making process. This begins with understanding the expected normal ranges for each test. Next, they should correlate any abnormal findings with the patient's signalment, history, and physical exam findings. If discrepancies or ambiguities arise, the technician should consult with the supervising veterinarian to discuss the findings and determine the next steps, which may include additional diagnostics or treatment. This collaborative approach ensures that laboratory data is used effectively to support accurate diagnosis and patient care. Question 10. To address the challenge of ensuring diagnostic quality in radiographic imaging, a veterinary technician is presented with several thoracic radiographs of a canine patient. The technician must determine which approach best reflects adherence to the principles of radiographic imaging and professional responsibility. Option A. Submitting all radiographs immediately to the veterinarian without any personal review, as the veterinarian is solely responsible for image interpretation. Option B. Reviewing the radiographs for the presence of the heart and lungs, assuming the veterinarian can interpret any image submitted. Option C. Focusing only on whether the entire thoracic cavity is visible in the image, regardless of other image quality factors. Option D. Evaluating each radiograph for proper collimation, adequate penetration density, appropriate contrast, absence of motion blur, and correct positioning relative to the anatomical structures of interest. The correct answer is B. Reviewing the radiographs for the presence of the heart and lungs, assuming the veterinarian can interpret any image submitted. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the veterinary technician to critically evaluate the quality of radiographic images for diagnostic purposes, which directly impacts patient care and diagnosis. The technician must possess a thorough understanding of radiographic principles to identify subtle artifacts or technical errors that could lead to misinterpretation by the veterinarian, potentially resulting in incorrect treatment plans or delayed diagnosis. This demands a high level of technical skill and judgment within the scope of practice, as defined by veterinary regulatory bodies. Correct approach analysis. The correct approach involves a systematic evaluation of the radiographic image based on fundamental principles of radiographic imaging, including proper positioning, exposure factors, and artifact identification. This aligns with the VTNE emphasis on assessing a technician's ability to produce and interpret diagnostic quality radiographs. Adhering to these principles ensures that the images are of sufficient quality for accurate veterinary interpretation, thereby upholding the standard of care and fulfilling the technician's ethical and professional responsibilities as outlined by veterinary practice acts and professional guidelines. Incorrect approach is analysis. One incorrect approach would be to assume that any image produced is acceptable as long as it is submitted to the veterinarian. This fails to acknowledge the technician's role in quality assurance and can lead to diagnostic errors, violating the principle of providing competent care. It also disregards the regulatory expectation that veterinary technicians possess the knowledge to produce diagnostic images. Another incorrect approach would be to focus solely on the presence of the anatomical structures of interest, without considering image quality factors like contrast, density, and sharpness. This oversight can mask subtle abnormalities or create false impressions, compromising diagnostic accuracy and potentially leading to patient harm, which is a direct contravention of professional standards and ethical obligations. A third incorrect approach would be to rely on subjective visual assessment without applying established radiographic quality criteria. This lack of objective evaluation makes it difficult to consistently identify and correct technical errors, undermining the reliability of the diagnostic process and failing to meet the expected level of technical proficiency for a credentialed veterinary technician. Professional reasoning. Veterinary technicians must develop a systematic approach to radiographic image evaluation. This involves understanding the ideal radiographic appearance for each view and species, recognizing common artifacts and their causes, and knowing how to adjust technical factors to optimize image quality. When faced with a questionable image, the professional decision-making process should involve comparing the image against established quality standards, identifying specific deviations, and determining the cause of the deviation. If the image is suboptimal, the technician should take corrective action, such as repeating the radiograph with appropriate adjustments, rather than submitting a diagnostically compromised image. This proactive approach ensures patient safety, supports accurate veterinary diagnosis, and upholds the integrity of the veterinary profession. Question 11. Stakeholder feedback indicates a need for enhanced understanding of how cellular components relate to observable patient conditions. A veterinarian is presented with a canine patient exhibiting profound lethargy and generalized weakness. The veterinarian suspects a systemic issue affecting cellular energy production, which cellular organelle is primarily responsible for generating the majority of a cell's supply of adenosine triphosphate, AT, the main energy currency of the cell, and therefore, if dysfunctional, would most likely explain these clinical signs. Option A, Golgi apparatus. Option B, endoplasmic reticulum. Option C, nucleus. Option D, mitochondrion. The correct answer is D, mitochondrion. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the veterinary technician to interpret and apply foundational knowledge of cellular biology to a practical, albeit hypothetical, diagnostic situation. The challenge lies in accurately identifying the cellular component responsible for a specific metabolic process and understanding how its dysfunction would manifest, all within the context of providing accurate information to a veterinarian. This demands not just recall of facts, but the ability to synthesize information and make a reasoned judgment about cellular function. Correct approach analysis. The correct approach demonstrates best professional practice by accurately identifying the mitochondrion as the primary site of cellular respiration and ATP production. Understanding that impaired mitochondrial function would directly impact energy availability for cellular processes, leading to symptoms like lethargy and weakness, is crucial for diagnostic reasoning. This aligns with the veterinary technician's role in observing patient status and communicating relevant findings to the veterinarian, contributing to accurate diagnosis and treatment planning. This is ethically sound as it prioritizes accurate information dissemination for patient welfare. Incorrect approaches analysis. One incorrect approach fails by misattributing cellular respiration to the nucleus. The nucleus's primary role is housing genetic material and controlling cellular activities, not energy production. This demonstrates a fundamental misunderstanding of cellular organelle function, which could lead to incorrect diagnostic hypotheses and miscommunication with the veterinarian, potentially compromising patient care. This represents a failure in professional competence and ethical duty to provide accurate information. Another incorrect approach errs by identifying the endoplasmic reticulum as the primary site of ATP synthesis. While the endoplasmic reticulum is involved in protein and lipid synthesis and calcium storage, it is not the main producer of ATP. This misidentification indicates a lack of understanding of core cellular physiology, which could lead to flawed diagnostic reasoning and ineffective communication, thereby failing the ethical obligation to act in the best interest of the animal. A further incorrect approach incorrectly assigns the primary role of ATP production to the Golgi apparatus. The Golgi apparatus is responsible for modifying, sorting, and packaging proteins and lipids for secretion or delivery to other organelles. It does not generate ATP. This demonstrates a significant gap in fundamental biological knowledge, which could result in the veterinary technician providing misleading information, hindering the diagnostic process and potentially leading to inappropriate treatment decisions. A clear ethical breach. Professional reasoning. Veterinary technicians must possess a robust understanding of basic animal cell structure and function to effectively assist in diagnosis and treatment. When presented with clinical signs, they should be able to correlate these signs with potential underlying cellular or organelle dysfunction. This requires a systematic approach. First, identifying the observed clinical signs. Second, recalling the normal function of various cellular components. And third, hypothesizing which cellular components' malfunction would most logically explain the observed signs. This analytical process, grounded in scientific knowledge, is essential for effective communication with veterinarians and for contributing to optimal patient outcomes. Question 12. Stakeholder feedback indicates that a veterinary technician is relaying laboratory results to a concerned client. The client expresses confusion and suggests an alternative interpretation of the results that contradicts the veterinarian's assessment. The veterinarian has previously explained their interpretation to the client. What is the most ethically and professionally appropriate course of action for the veterinary technician? Option A. Tell the client that the technician cannot discuss the results and that they must wait to speak with the veterinarian. Option B. Inform the client that the results are normal and that there is no need for further concern. Option C. Directly explain to the client why their interpretation is incorrect and provide the technician's own interpretation of the results. Option D. Reiterate the veterinarian's interpretation of the results, offer to clarify any specific points of confusion, and suggest the veterinarian can speak with the client again if further discussion is needed. The correct answer is D. Reiterate the veterinarian's interpretation of the results, offer to clarify any specific points of confusion, and suggest the veterinarian can speak with the client again if further discussion is needed. Explanation. Scenario analysis. This scenario presents an ethical dilemma for a veterinary technician regarding client communication and the interpretation of laboratory results. The challenge lies in balancing the veterinarian's directive with the technician's ethical obligation to provide accurate and understandable information to the client, especially when the client's interpretation might be based on incomplete or misunderstood data. The technician must navigate potential client distress and ensure they are not overstepping professional boundaries while still advocating for the animal's well-being. Correct approach analysis. The correct approach involves the veterinary technician accurately relaying the veterinarian's interpretation of the laboratory results to the client, while also offering to clarify any points of confusion. This upholds the veterinarian's primary role in diagnosis and treatment planning, while empowering the technician to facilitate client understanding. It aligns with the AVMA principles of veterinary medical ethics, which emphasize honesty, integrity, and the importance of clear communication between the veterinary team and clients. Specifically, it respects the veterinarian's authority while ensuring the client receives accurate information and has an opportunity for further clarification, preventing misinterpretations that could lead to suboptimal care or client dissatisfaction. Incorrect approaches analysis. One incorrect approach is to directly contradict the veterinarian's interpretation and provide the client with a different explanation. This is a significant ethical failure, as it undermines the veterinarian's professional judgment and authority, potentially creating distrust within the veterinary team and confusion for the client. It also represents a breach of professional conduct by the technician, who is not authorized to independently interpret and communicate diagnostic findings in a manner that supersedes the veterinarian's assessment. Another incorrect approach is to simply state that the results are normal without further context or clarification, especially if the client is expressing concern or confusion. This fails to adequately address the client's anxieties and may lead them to believe that their concerns are unfounded, potentially delaying necessary follow-up or treatment. It also neglects the technician's role in client education and support, which is crucial for fostering a positive client-veterinary relationship. A third incorrect approach is to avoid the conversation altogether or defer the client to the veterinarian without offering any immediate assistance in understanding the information. While deferring complex medical advice to the veterinarian is appropriate, a complete avoidance of the client's expressed confusion can be perceived as dismissive and unhelpful. The technician has a responsibility to facilitate communication and understanding to the best of their ability within their scope of practice. Professional reasoning. When faced with a situation where a client is questioning or misunderstanding laboratory results, a veterinary technician should follow a structured decision-making process. First, they should confirm the veterinarian's interpretation and ensure they fully understand it themselves. Second, they should listen empathetically to the client's concerns and questions. Third, they should relay the veterinarian's interpretation clearly and concisely, using language that the client can understand. Fourth, they should offer to clarify any specific points of confusion or offer to have the veterinarian speak with the client again. This approach prioritizes accurate communication, client education, and the collaborative nature of veterinary care, all while respecting professional roles and ethical guidelines. Question 13. Strategic planning requires a veterinary technician to anticipate and mitigate potential risks when handling a new patient. Given a recently admitted, unexamined canine exhibiting signs of fear and anxiety, which of the following represents the most prudent and professionally responsible initial approach to facilitate safe examination and potential treatment? Option A. Ask the veterinarian to administer a sedative before any handling is attempted, regardless of the dog's current level of agitation or the specific examination needs. Option B. Immediately secure the dog using a muzzle and a slip lead, then proceed with a forceful physical restraint to ensure the veterinarian can perform a thorough examination without delay. Option C. Rely on the veterinarian to direct all aspects of restraint and handling, and only proceed with physical contact when explicitly instructed to do so, without independently assessing the situation. Option D. Approach the dog calmly, speak in a low, reassuring tone, and allow it to approach the technician on its own terms while observing its body language for signs of escalating stress before attempting any physical contact. The correct answer is D. Approach the dog calmly, speak in a low, reassuring tone, and allow it to approach the technician on its own terms while observing its body language for signs of escalating stress before attempting any physical contact. Explanation: this scenario is professionally challenging because it requires the veterinary technician to balance the immediate need for patient care with the inherent risks associated with handling a potentially stressed or fearful animal. The technician must assess the species-specific behavior, the environment, and the available resources to implement the safest and most effective handling technique. This requires a deep understanding of animal behavior, species-specific anatomy, and the application of established safety protocols, all within the framework of veterinary practice regulations. The correct approach represents best professional practice because it prioritizes patient and personnel safety through a systematic, species-appropriate assessment. This aligns with the core ethical and regulatory responsibilities of veterinary technicians to provide competent care while minimizing harm. Adhering to established protocols for restraint, understanding species-specific stress signals, and utilizing appropriate equipment are fundamental to preventing injury to both the animal and the handler. This proactive and informed approach is a direct reflection of the professional standards expected and enforced by regulatory bodies governing veterinary technicians. An incorrect approach that involves forcing restraint without adequate assessment or using excessive force is professionally unacceptable. This demonstrates a failure to uphold the duty of care owed to the animal, potentially leading to physical injury, exacerbation of stress, and a breakdown of trust between the animal and the veterinary team. Such actions could be considered a violation of animal welfare regulations and ethical guidelines that mandate humane treatment and the avoidance of unnecessary suffering. Furthermore, neglecting to use appropriate personal protective equipment or failing to secure the environment can lead to handler injury, which is a breach of workplace safety regulations and professional responsibility. Relying solely on the veterinarian's direction without contributing to the safety assessment or questioning potentially unsafe methods also represents a failure in professional judgment and a lack of proactive engagement in patient care. Professionals should employ a decision-making framework that begins with a thorough risk assessment. This involves identifying the species, its known temperament, the reason for restraint, and the environment. Next, the technician should consider the least stressful and safest restraint method for that specific situation, taking into account available equipment and personnel. Communication with the veterinary team is crucial to ensure everyone is aware of the plan and potential risks. Finally, continuous reassessment of the animal's behavior during the procedure is vital to adjust the handling technique as needed, always prioritizing safety and welfare. Question 14. Consider a scenario where a veterinarian prescribes amoxi drops for a feline patient diagnosed with a respiratory infection. The medication label indicates it can be administered orally or via nebulization. The veterinary technician is aware that oral administration is common for this drug, but also knows nebulization can be effective for respiratory conditions. The technician has not been explicitly told which route the veterinarian prefers for this specific case. What is the most appropriate course of action for the veterinary technician in this situation? Option A. Choose nebulization because it is a route specifically indicated for respiratory infections. Option B. Administer the medication via the route that requires the least amount of time and effort to prepare and administer. Option C. Consult a current veterinary drug reference and, if necessary, communicate with the prescribing veterinarian to confirm the intended administration route. Option D. Administer the amoxi drops orally, as this is the most common route for this medication. The correct answer is C. Consult a current veterinary drug reference and, if necessary, communicate with the prescribing veterinarian to confirm the intended administration route. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the veterinary technician to interpret a veterinarian's order for a medication that has multiple administration routes, each with distinct absorption rates and potential side effects. The technician must not only understand the drug's properties, but also consider the patient's specific condition and the implications of each route for efficacy and safety. Failure to select the most appropriate route can lead to therapeutic failure, adverse drug reactions, or unnecessary patient distress, all of which fall under the technician's professional responsibility. Correct approach analysis. The correct approach involves consulting reliable veterinary drug references and, if necessary, clarifying the intended administration route with the prescribing veterinarian. This demonstrates adherence to professional standards of care, which mandate that veterinary technicians possess and apply knowledge of pharmacology and drug administration. By verifying the route, the technician ensures the medication is administered in a manner that maximizes therapeutic benefit while minimizing risks, aligning with the principles of patient safety and competent practice as expected by veterinary regulatory bodies. This proactive communication and reference checking is a cornerstone of responsible veterinary practice. Incorrect approaches analysis. Administering the medication via the most commonly used route without verification is a failure to exercise due diligence. This bypasses the critical step of confirming the veterinarian's specific intent for this patient and this drug, potentially leading to an inappropriate administration that could be ineffective or harmful. This constitutes a breach of professional responsibility and could be considered negligence. Choosing an administration route based solely on personal preference or past experience with similar drugs without confirming the current order is also a significant ethical and regulatory failure. Veterinary practice requires individualized patient care, and assumptions can lead to errors. This approach disregards the specific instructions and the unique needs of the patient, violating the duty of care owed to the animal. Administering the medication via the route that appears easiest or quickest, without considering the drug's pharmacokinetics or the patient's condition, is a direct contravention of safe and effective veterinary practice. This prioritizes convenience over patient welfare and professional judgment, which is unacceptable and could result in adverse outcomes, potentially leading to disciplinary action from regulatory boards. Professional reasoning. When faced with an ambiguous or potentially multifaceted medication order, the professional decision-making process should always begin with a thorough review of the order and the drug's properties. This should be followed by consulting authoritative veterinary drug references to understand all possible administration routes, their indications, contraindications, and pharmacokinetic profiles. If any ambiguity remains or if the chosen route presents potential risks for the specific patient, direct communication with the prescribing veterinarian is paramount. This iterative process of review, reference, and clarification ensures that patient safety and therapeutic efficacy are prioritized, upholding the highest standards of veterinary technical practice. Question 15. The investigation demonstrates a 5-year-old canine presenting to the emergency clinic with acute onset of lethargy, dyspnea, and pale mucous membranes. The veterinarian is currently attending to another critical case and has asked you to begin initial assessment and stabilization. Which of the following approaches is the most appropriate initial action for the veterinary technician? Option A. Perform a thorough head-to-tail physical examination, including assessment of airway patency, respiratory effort and rate, heart rate and rhythm, mucous membrane color, capillary refill time, and mentation. Option B. Begin a detailed assessment of the patient's skin turgor and coat condition while waiting for the veterinarian to provide specific instructions. Option C. Administer the broad-spectrum antibiotic and pain medication that was prescribed for the patient's last visit for a similar presentation. Option D. Place an intravenous catheter and administer a bolus of intravenous fluids as per standard emergency protocol without further immediate assessment. The correct answer is A. Perform a thorough head-to-tail physical examination, including assessment of airway patency, respiratory effort and rate, heart rate and rhythm, mucous membrane color, capillary refill time, and mentation. Explanation. This scenario is professionally challenging because the veterinary technician is faced with a rapidly deteriorating patient where immediate, accurate assessment is critical for survival. The technician must prioritize actions based on the most life-threatening issues, demonstrating a high level of critical thinking and diagnostic reasoning under pressure. The veterinarian's absence necessitates the technician taking initiative within their scope of practice to gather essential data. The correct approach represents best professional practice because it prioritizes a systematic head-to-tail assessment focusing on the ABCs, airway, breathing, circulation, and neurological status, which are the most immediate determinants of life. This aligns with the VTNE emphasis on the technician's role in patient assessment and monitoring, ensuring that critical interventions are not delayed. By gathering vital signs, assessing mentation, and evaluating mucous membrane color and capillary refill time, the technician is providing the veterinarian with the most crucial information to guide further diagnostics and treatment. This proactive and thorough approach is consistent with the ethical obligation to provide competent and compassionate care, as expected of a credentialed veterinary technician. An incorrect approach that involves solely focusing on administering prescribed medications without a current, comprehensive assessment fails to address the dynamic nature of a critically ill patient. This could lead to delayed recognition of worsening conditions or adverse drug reactions, potentially violating the duty of care and the technician's responsibility to report changes in patient status. Another incorrect approach, such as waiting for explicit instructions for every single assessment step, demonstrates a lack of initiative and critical judgment, which is contrary to the expectations of a veterinary technician in an emergency situation. This can result in a critical delay in gathering life-saving information. Furthermore, an approach that prioritizes less critical systems, like integumentary assessment, before addressing airway, breathing, or circulation, is a failure of professional judgment and could have fatal consequences for the patient, directly contravening the core principles of veterinary patient care. Professionals should employ a decision-making framework that begins with recognizing the urgency of the situation. This involves a rapid initial assessment of the patient's overall status, followed by a systematic prioritization of diagnostic and monitoring steps based on the potential for immediate life threat. The technician should always be prepared to communicate findings clearly and concisely to the veterinarian, advocating for the patient's needs based on their assessment. Question 16. Upon reviewing the medical record for a fractious feline patient scheduled for a dental prophylaxis, which restraint method and equipment would be considered the most appropriate and ethically sound choice to ensure the safety of the patient and the veterinary team while adhering to best practices for animal welfare? Option A. A thick leather muzzle and a heavy-duty nylon leash, applied with firm, consistent pressure. Option B. A wire muzzle and a slip lead, with the slip lead positioned high on the neck to restrict head movement. Option C. A tranquilizer administered by the veterinarian, followed by minimal manual restraint with no additional equipment. Option D. A well-fitting Elizabethan collar and a soft, padded muzzle, used in conjunction with a towel wrap for the body. The correct answer is A. A thick leather muzzle and a heavy-duty nylon leash, applied with firm, consistent pressure. Explanation. This scenario presents a common challenge in veterinary practice, balancing the need for safe and effective restraint with the animal's welfare and the safety of the veterinary team. The veterinary technician must apply knowledge of restraint techniques and equipment within the legal and ethical framework governing veterinary practice in the United States, as dictated by the VTNE regulatory scope. The correct approach prioritizes the use of the least restrictive method that achieves the necessary control for the procedure, aligning with principles of animal welfare and professional responsibility. This involves selecting equipment and techniques appropriate for the species, temperament, and medical condition of the animal, and ensuring the equipment is used correctly to prevent injury to both the animal and the handler. Adherence to established veterinary protocols and guidelines, which are implicitly tested by the VTNE, is paramount. An incorrect approach would involve using excessive force or inappropriate equipment that could cause undue stress, pain, or injury to the animal. This could violate state veterinary practice acts, which often include provisions for humane treatment of animals and professional standards of care. For example, using a choke chain for restraint during a routine examination, or employing a technique that compromises the animal's airway or circulation, would be ethically and potentially legally problematic. Another failure would be to use equipment without proper training or understanding of its application, leading to accidental harm. Such actions demonstrate a lack of professional judgment and a disregard for animal welfare, which are core tenets of veterinary technician practice. The professional reasoning process should involve a thorough assessment of the animal's condition, the nature of the procedure, and the available resources. The technician should consider the animal's species, breed, age, temperament, and any known medical issues that might affect its response to restraint. They should then select the most appropriate restraint method and equipment, always erring on the side of caution, and employing the least invasive technique that will ensure safety. Continuous monitoring of the animal's response during restraint is crucial, with adjustments made as needed. If a chosen method proves ineffective or causes undue distress, the technician must be prepared to switch to an alternative or seek assistance. Question 17. Risk assessment procedures indicate that a veterinary technician is preparing to collect multiple diagnostic samples from a stable but mildly dehydrated canine patient. The technician needs to obtain a urine sample for urinalysis, a blood sample for a complete blood count, CBC and chemistry panel, and a fine needle aspirate from a palpable subcutaneous mass. Which of the following approaches best ensures patient safety and diagnostic accuracy while adhering to established veterinary protocols? Option A. Collect the urine sample via cystocentesis using a sterile needle and syringe after preparing the ventral abdomen with an alcohol wipe. Collect the blood sample from the cephalic vein using a sterile needle and syringe after preparing the venipuncture site with chlorhexidine scrub. Obtain the fine needle aspirate from the subcutaneous mass using a sterile needle and syringe, cleaning the surface of the mass with an alcohol wipe prior to aspiration. Option B. Collect the urine sample via cystocentesis using a sterile needle and syringe after preparing the ventral abdomen with an alcohol wipe. Collect the blood sample from the cephalic vein using a sterile needle and syringe, but do not prepare the venipuncture site as the patient is cooperative. Obtain the fine needle aspirate from the subcutaneous mass using a sterile needle and syringe, cleaning the surface of the mass with an alcohol wipe prior to aspiration. Option C. Collect the urine sample via free catch, allowing the patient to urinate into a sterile collection cup without any site preparation. Collect the blood sample from the jugular vein using a sterile needle and syringe, but do not prepare the venipuncture site as the patient is cooperative. Obtain the fine needle aspirate from the subcutaneous mass using a sterile needle and syringe without any surface cleaning. Option D. Collect the urine sample via free catch, allowing the patient to urinate into a sterile collection cup after preparing the perineal area with an alcohol wipe. Collect the blood sample from the jugular vein using a sterile needle and syringe after preparing the venipuncture site with chlorhexidine scrub. Obtain the fine needle aspirate from the subcutaneous mass using a sterile needle and syringe, cleaning the surface of the mass with an alcohol wipe prior to aspiration. Correct answer is A. Collect the urine sample via cystocentesis using a sterile needle and syringe after preparing the ventral abdomen with an alcohol wipe. Collect the blood sample from the cephalic vein using a sterile needle and syringe after preparing the venipuncture site with chlorhexidine scrub. Obtain the fine needle aspirate from the subcutaneous mass using a sterile needle and syringe, cleaning the surface of the mass with an alcohol wipe prior to aspiration. Explanation: this scenario is professionally challenging because it requires the veterinary technician to balance the immediate need for diagnostic information with the potential risks to the patient and the integrity of the sample. The technician must make a judgment call based on their understanding of aseptic technique, patient stability, and the specific requirements for each diagnostic test. Careful consideration of the patient's condition and the potential for complications during sample collection is paramount. The correct approach represents best professional practice because it prioritizes patient safety and the quality of diagnostic samples. Aseptic technique is a fundamental principle in veterinary medicine, directly impacting the accuracy of diagnostic results and preventing iatrogenic infections. When collecting blood, urine, or performing cytology, adhering to sterile procedures minimizes contamination, ensuring that the collected samples accurately reflect the patient's condition. This aligns with the ethical responsibility to provide competent care and avoid harm, as well as regulatory expectations for accurate record-keeping and diagnostic procedures. An incorrect approach involving the collection of a urine sample without proper aseptic technique is professionally unacceptable. This failure to adhere to sterile procedures significantly increases the risk of bacterial contamination, leading to inaccurate urinalysis results. Such contamination could result in misdiagnosis, inappropriate treatment, and unnecessary costs for the owner. This directly violates the ethical duty to provide competent care and the regulatory expectation for accurate diagnostic procedures. Another incorrect approach, such as collecting a blood sample from a jugular vein without first preparing the venipuncture site with an antiseptic scrub, is also professionally unacceptable. This omission compromises the sterility of the collection site, increasing the risk of introducing bacteria into the bloodstream. This can lead to local infection at the venipuncture site or even systemic infection, septicemia, posing a serious threat to patient health. This failure constitutes a breach of the duty of care and a violation of established veterinary protocols designed to prevent harm. Finally, an incorrect approach that involves using a non-sterile needle and syringe for a fine needle aspirate of a skin lesion, without any attempt at site preparation, is highly problematic. This practice dramatically increases the likelihood of introducing skin flora into the aspirate, leading to contaminated cytology samples. Contaminated samples can obscure the true cellular morphology, making accurate diagnosis difficult or impossible. This directly undermines the diagnostic purpose of the procedure and represents a failure to uphold professional standards for sample integrity. The professional decision-making process for similar situations should involve a systematic risk assessment. First, evaluate the patient's condition and any contraindications for the proposed sample collection. Second, identify the specific requirements for each sample type, e.g., sterile urine collection, aseptic blood draw, sterile cytology needle. Third, select the most appropriate technique and equipment to minimize risk and maximize sample quality. Fourth, execute the procedure with meticulous attention to aseptic technique. Finally, document the procedure and any deviations from standard protocols. This structured approach ensures that patient welfare and diagnostic accuracy are consistently prioritized. Question 18. Examination of the data shows a canine patient presenting for a routine physical examination. During the initial approach, the dog exhibits lip licking, yawning, and whale eye, while also emitting low growls when the technician attempts to place a stethoscope around its neck. The technician needs to proceed with the examination. Option A. Gently restrain the dog, speaking in a calm, reassuring voice, and attempt to distract it with a treat while continuing to place the stethoscope. Option B. Immediately attempt to physically overpower the dog and hold it firmly in position to complete the examination. Option C. Proceed with the examination as planned, ignoring the dog's vocalizations and body language, assuming it will eventually comply. Option D. Inform the veterinarian of the dog's behavior and suggest a brief period of acclimatization with the technician present, but not actively handling the dog, before re-attempting the examination. The correct answer is A. Gently restrain the dog, speaking in a calm, reassuring voice, and attempt to distract it with a treat while continuing to place the stethoscope. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires the veterinary technician to interpret subtle behavioral cues in a distressed animal and apply knowledge of animal behavior to ensure both the animal's welfare and the safety of the veterinary team. Misinterpreting these cues can lead to ineffective handling, increased stress for the animal, potential injury to the animal or staff, and a breakdown in the veterinarian-client-patient relationship. The technician must balance the need for diagnostic procedures with the animal's emotional state and innate responses. Correct approach analysis. The correct approach involves recognizing that the animal's behavior is a form of communication indicating fear and anxiety. By employing a low-stress handling technique that respects the animal's space and avoids direct confrontation, the technician is prioritizing the animal's emotional well-being. This aligns with the ethical principles of veterinary practice, which mandate minimizing animal suffering and distress. Furthermore, by observing and documenting these behaviors, the technician provides crucial data for the veterinarian to make informed diagnostic and treatment decisions, fulfilling their role in the veterinary healthcare team as outlined by Veterinary Technician Practice Acts and Guidelines. This approach demonstrates a commitment to compassionate care and professional responsibility. Incorrect approaches analysis. One incorrect approach involves forcing the animal into position despite its vocalizations and body language. This disregards the animal's communication of distress and fear, potentially exacerbating its anxiety and leading to a negative association with veterinary care. Ethically, this fails to uphold the duty to minimize suffering. Legally, depending on the jurisdiction's animal welfare laws, such forceful handling could be considered neglect or abuse if it causes undue pain or distress. Another incorrect approach is to ignore the animal's behavior and proceed with the examination as if it were compliant. This demonstrates a lack of understanding of animal behavior and communication, a core competency for veterinary technicians. It fails to acknowledge the animal's sentience and its right to be handled with consideration. This approach can lead to increased stress, potential for escape attempts, and a compromised examination due to the animal's resistance, ultimately hindering effective veterinary care. A third incorrect approach is to sedate the animal immediately without attempting any non-pharmacological de-escalation techniques. While sedation may be necessary in some cases, it should not be the first resort when behavioral modification and low-stress handling might suffice. This approach bypasses the opportunity to understand the animal's baseline behavior and the triggers for its anxiety, and it carries inherent risks associated with anesthesia. It also fails to utilize the technician's skills in behavioral assessment and management, potentially leading to over-reliance on chemical restraint. Professional reasoning. When faced with a distressed animal, a veterinary technician should first observe and interpret the animal's body language and vocalizations to assess its emotional state. This involves understanding species-specific behaviors and recognizing signs of fear, anxiety, or aggression. Next, the technician should employ low-stress handling techniques, such as approaching calmly, avoiding direct eye contact, and allowing the animal to acclimate to its surroundings. If these techniques are insufficient, the technician should communicate their observations and concerns to the veterinarian, who can then determine the most appropriate course of action, which may include further behavioral modification strategies or pharmacological intervention. This systematic approach ensures the animal's welfare, the safety of the team, and the provision of high-quality veterinary care. Question 19. Performance analysis shows that veterinary technicians frequently encounter situations where clients express financial limitations that conflict with recommended preoperative diagnostic procedures. In such a scenario, a veterinary technician is informed by a client that they cannot afford the full panel of blood work and urinalysis recommended by the veterinarian prior to a routine space surgery, stating, "We just can't afford all of that right now." The technician knows these diagnostics are crucial for identifying potential anesthetic risks and ensuring patient safety. What is the most ethically and professionally appropriate course of action for the veterinary technician? Option A. Discuss the importance of the recommended diagnostics with the client. Explain the potential risks of proceeding without them, and collaborate with the veterinarian to explore alternative diagnostic options or a phased approach that addresses the client's financial concerns while prioritizing patient safety. Option B. Firmly insist that the surgery cannot proceed without the full diagnostic panel, regardless of the client's financial situation, and explain that it is non-negotiable. Option C. Offer to perform the surgery at a discounted rate or suggest that the clinic can absorb some of the diagnostic costs to make it affordable for the client. Option D. Immediately agree to proceed with the surgery without the recommended diagnostics to accommodate the client's financial constraints, assuring them that it will likely be fine. The correct answer is A. Discuss the importance of the recommended diagnostics with the client, explain the potential risks of proceeding without them, and collaborate with the veterinarian to explore alternative diagnostic options or a phased approach that addresses the client's financial concerns while prioritizing patient safety. Explanation. Scenario analysis. This scenario presents an ethical dilemma where a veterinary technician is faced with conflicting priorities. client financial constraints, and the veterinarian's recommendation for optimal patient care. The challenge lies in balancing the client's ability to pay with the professional obligation to advocate for the patient's well-being and adhere to established veterinary standards of care. The technician must navigate this delicate situation without overstepping professional boundaries or compromising the veterinarian client-patient relationship. Correct approach analysis. The correct approach involves open and honest communication with the client, clearly explaining the rationale behind the recommended preoperative diagnostics and their importance for patient safety and surgical success. This aligns with the ethical principles of veterinary practice, which emphasize informed consent and acting in the best interest of the animal. By presenting alternatives and exploring financial solutions in collaboration with the veterinarian, the technician upholds professional responsibility and client trust. This approach respects the client's financial situation while prioritizing the patient's welfare, a cornerstone of veterinary technician practice as outlined by professional guidelines that stress client education and support. Incorrect approaches analysis. One incorrect approach involves immediately agreeing to proceed with surgery without the recommended diagnostics, solely based on the client's stated financial inability. This fails to uphold the professional duty to advocate for the patient's safety and can lead to increased risks during anesthesia and surgery, potentially resulting in adverse outcomes. This bypasses the veterinarian's professional judgment and the established protocols for patient assessment, which could be seen as a breach of professional conduct and a failure to adhere to standards of care. Another incorrect approach is to dismiss the client's financial concerns and insist on the full diagnostic panel without exploring any compromises or alternatives. This demonstrates a lack of empathy and can damage the client's trust and the veterinarian client-patient relationship. It fails to acknowledge the client's legitimate financial limitations and can lead to the client seeking care elsewhere or forgoing necessary treatment altogether, ultimately harming the patient. This approach neglects the importance of client communication and collaboration, which are vital components of ethical veterinary practice. A third incorrect approach is to offer to perform the surgery at a reduced cost or to absorb some of the diagnostic costs personally. This is professionally inappropriate as it blurs the lines of financial responsibility, potentially creates conflicts of interest, and is outside the scope of a veterinary technician's role in financial management. It also sets a precedent that can be difficult to manage and may not be sustainable. Veterinary technicians are not authorized to set prices or offer discounts, and engaging in such practices can have serious ethical and legal ramifications. Professional reasoning. Professionals should approach such situations by first understanding the veterinarian's recommendations and the underlying medical rationale. They should then engage in empathetic and transparent communication with the client, explaining the importance of the diagnostics and the potential risks of proceeding without them. The next step is to collaborate with the veterinarian to explore all possible options, including phased diagnostics, alternative testing, or discussing the risks and benefits of proceeding with a reduced diagnostic workup. This collaborative and client-centered approach ensures that patient welfare is prioritized, while respecting the client's financial realities and maintaining professional integrity. Question 20. The risk matrix shows a moderate risk of surgical site infection if aseptic technique is compromised during a routine spay procedure. During instrument preparation, the veterinary technician notices a small tear in the sterile packaging of a critical surgical instrument. What is the most appropriate immediate action to maintain regulatory compliance and patient safety? Option A. Continue with the surgery but make a note in the patient's record about the torn packaging. Option B. Discard the compromised instrument and its packaging, then retrieve a new sterile instrument, reprepping the surgical site if necessary. Option C. Ask the veterinarian if it is acceptable to use the instrument despite the torn packaging. Option D. Proceed with the surgery using the instrument, assuming the tear is minor and unlikely to cause contamination. The correct answer is B. Discard the compromised instrument and its packaging, then retrieve a new sterile instrument, reprepping the surgical site if necessary. Explanation. Scenario analysis. This scenario presents a professional challenge due to the inherent risks associated with surgical procedures and the critical need for meticulous adherence to aseptic technique. The veterinary technician's judgment is paramount in identifying and mitigating potential breaches that could compromise patient safety and lead to adverse outcomes, such as surgical site infections. The pressure of a busy surgical schedule can exacerbate these challenges, requiring the technician to remain vigilant and prioritize patient well-being above all else. Correct approach analysis. The correct approach, which involves immediately addressing the potential break in aseptic technique by discarding contaminated items and reprepping, represents best professional practice. This aligns with the core principles of veterinary nursing as outlined by regulatory bodies and ethical guidelines, which mandate the highest standards of patient care and safety. Specifically, this action directly upholds the veterinary technician's responsibility to prevent infection and ensure the integrity of the surgical field, thereby minimizing patient risk and adhering to established protocols for sterile procedures. This proactive measure prevents further contamination and potential complications, demonstrating a commitment to patient welfare and professional accountability. Incorrect approaches analysis. One incorrect approach involves continuing the procedure with the potentially contaminated instruments, assuming the risk is minimal. This is a significant regulatory and ethical failure. It directly violates the principles of aseptic technique, which are fundamental to preventing surgical site infections. Such an action could lead to patient harm, necessitating further treatment and potentially increasing costs and suffering for the animal. Ethically, it represents a breach of the duty of care owed to the patient. Another incorrect approach is to proceed with the surgery, but to document the potential contamination without taking immediate corrective action. While documentation is important, it does not mitigate the immediate risk of infection. This approach fails to address the problem proactively and places the patient at unnecessary risk. It demonstrates a lack of commitment to immediate patient safety and a failure to uphold the highest standards of surgical nursing practice. A third incorrect approach is to delegate the decision of whether to re-sterilize or discard to the veterinarian without first taking immediate action to prevent further contamination. While collaboration with the veterinarian is crucial, the veterinary technician has a direct responsibility to maintain the sterile field. Delaying action while seeking further instruction allows the contamination to persist, increasing the risk to the patient. This approach can be seen as a failure to exercise professional judgment and take immediate responsibility for patient safety within the technician's scope of practice. Professional reasoning. Professionals should employ a decision-making framework that prioritizes patient safety and adheres strictly to established protocols. This involves 1. Rapid assessment of the situation to identify potential risks. 2. Immediate implementation of corrective actions to mitigate identified risks following established aseptic techniques. 3. Clear and concise communication with the veterinary team regarding any deviations or concerns. 4. Thorough documentation of all actions taken. In surgical nursing, a when in doubt, throw it out mentality regarding sterile supplies is a critical component of this framework, ensuring that patient well-being is never compromised by expediency or assumption.